It is what it is. We're all involved with it. And to honor the people who have gone through it, who have made their lives different and better. And hopefully we'll be seeing them for a long time. That's the whole point. I just kid with my patients. I say, I can't make any money if you don't come back and see me. But I get paid by the hospital, so you don't have to worry about it. Anyway, I'd like to just share a couple things first. Can you guys all hear me? All good? Yes? I'd like to share a couple things, just some general statistics. I don't want to bore you with statistics, but just to show you, once again, sort of the depth of what's out there and what we're all dealing with. And I think that's going to be important. We're going to talk about what's going on at Meadville Medical Center for just a moment. And then we're going to have some presentations, just 3 quick presentations. We have, I think, some good stories and songs to sing for you. So I don't sing well, so I will speak, but if you want me to sing, I can try. Cardiovascular disease is still the leading cause of death in men and women. It's about 800,000 people per year die of any form of cardiovascular disease. I hate to say this statistic, but I think it's important. 1 person dies every 40 seconds in this country of cardiovascular disease. So as we sit here for 2 hours, between 1 and 3, it's 180 people that died. So it's huge. 1 in 7 deaths, about 45% of them are from heart attacks and that sort of thing. The cardiovascular disease also involves strokes, involves aneurysms, other vascular problems. But heart attacks, per se, it's about half of those deaths. Heart attacks per year, it's about the same. It's almost 800,000 heart attacks. Not everybody dies from one, but about 1 patient every 40 seconds, a person has a heart attack. So again, 180 people in this country will have a heart attack while we're sitting here chatting about this. So it's a astronomical hurdle to jump over. I'll give you some good news in a moment here. Strokes are about the same. It's about 1 in every 40 seconds there's a stroke. Okay, that's devastating. The average age, interestingly, for heart attacks for males is 65. For females, it's 71. But we see people from their late 20s all the way up to their 90s with heart attack. But those are just the average ages. I think the best statistic I have, though, is that between 2004 and 2014, so a 10-year period, there was basically a decline in deaths from heart attacks and cardiovascular disease by 35%. So in 10 years, the numbers have come down. We've seen lower and lower numbers of patients having the big heart attacks that get you immediately into the cath lab and opened up. And it's because of more awareness, early aggressive treatment. Our EMS, represented here by Meadville Ambulance, working with us together to try to get people here quicker, streamline the system, and get them where they need to be. Out in the community, there are people who can do CPR. There's classes. CPR has been streamlined now, so it's much easier than it ever was to help save a life in somebody. So the newer courses that are out there, they're online through the American Heart Association. You'll hear a story today about somebody who saved his wife, basically because he did very good CPR and kept her alive until EMS got there and was able to do their work. AEDs, the external defibrillators, are pretty much, not everywhere, but they're in a lot of institutions now. It'll say on the box, don't use this unless you're trained in it. It's the simplest thing to use. Okay, it tells you exactly what to do, tells you where to put the patches on. The thing talks to you, it says, no, don't do this or step away. There's going to be a treatment given to the patient. So I would never walk away from a box that says, use only if you're trained in using it. Never hurt somebody by using it. Trust me, I think that's an important piece of it. I had never used one before. I have all this fancy stuff in the cath lab. We can just hit a button, it's fine, button. I had to use one. My wife Kelly and I had to use one, and it was our first time ever seeing one in use. Was when we had to use it in an emergency, and it was not rocket science to put on the patient. So don't be afraid of the little red packet in the box. They're stuck on the walls all around the place. And I think early catheterization has helped decrease mortality in patients having the big one. Again, we've been working well with our emergency medical services, incredibly well, so that we have communication now of somebody having a heart attack out in the field, coming to us. We have a gentleman who will be speaking with you shortly here, just sharing his story that was in that situation where he didn't have to go through the emergency room. He was diagnosed out in the field, EKG done. We had word that he was coming in. We had time to get in, waiting for him in the cath lab, get him in there, do the procedure, and we can get down to roughly 15 minutes from the time somebody arrives in the cath lab so we have that artery opened up again. Traditionally, we try to get under 90 minutes through the ER. We get the phone call, people live 20, 30 minutes away. It takes a long time. And if we can get notification ahead of time, it's really important. We trust what these guys say. If they can't get us the EKG directly to us, which we have mechanisms to do that, but sometimes the phone services are patchy out in the rural areas. If we can't, we trust what they say. If they say this person's having a heart attack, we call in the team, and we're there ready for it. So I think that's made a big difference in the last couple of years. I'll say that Anika Oliver, who runs our cath lab, and myself have been out talking to EMS with the help of Eric here, who we've been out there basically talking face to face, meeting people, saying how can we make it. Makes my life a lot worse. Heart attacks here than we ever wanted, but that's what people need. So it doesn't make my life worse. It just means we're busier and we're doing what we're supposed to be doing. So I'm going to shut up with that. Let me go through some of the Meadville Medical Center statistics, just briefly to show you the scope of what we do here. The cath lab, I'll remind you, opened back in 2002. So doing just procedures, taking pictures, the cath lab's been around since that long. I've been here about 5 years, so that long predated me. The first intervention, angioplasty or stent that was ever done, was done in October of 2010. So they got the permission from the state to go ahead and do these procedures. The first big heart attack, somebody coming in, having the big one that needed to go immediately to the cath lab, wasn't until the 31st of January in 2011. So we haven't been doing them that long here, but we've been doing a lot since that long, and doing them well. We actually have very, very exceptional statistics for survival, for getting people done. Again, our goal is to get people in 90 minutes from the time they hit the door to a balloon gets open and opening that artery. We average about 53 minutes. Lately, we've been seeing 15, 20-minute door-to-balloon times because working with our emergency services, they come directly to us. They don't have to go to the ER and waste all that time through the emergency room. So I think that's been exceptional. The other thing that we've seen a change in, which I also think is exceptional, is that a couple of years ago we looked at these numbers, and about 60% of our patients having a big heart attack came by car. Okay, so that's a problem in some circumstances. Now, in these parts, it's a little tricky, because if you live real close to the hospital or you live real far away, sometimes that time can make a big difference, and waiting for an ambulance is always people's concern, which hasn't been a big issue for us. And now we're actually up to this past year, of all the big heart attacks that came in, 67% of those patients came by ambulance, which I think is awesome, because now you're in the hands of somebody that can shock you, they can get you back in rhythm, they can give medications, they can breathe for you, all that sort of stuff. So it's important to get somebody involved very early on that can do that, rather than just popping somebody in a car and we've seen disasters with that, unfortunately. When people arrive at the emergency room door and somebody's propping somebody up in the front seat that basically died 10 minutes ago and can't be resuscitated. So it's important to keep EMS right up there. They do more than just transport. They do tons more than transport, and then they can call us and let us know that the patient's coming so we can expedite the care. This past year, we did about 460 heart caths in our lab, which is good for a medical center this size. We did close to 140 interventions. That's putting stents in. We had 64 patients with big heart attacks, so at least one a week, a little more than one a week. They tend to come in waves. We get 2 or 3 in a day, and nothing for a couple weeks, but snow shoveling doesn't help, that sort of thing. But the bottom line is it's a steady thing that comes through the door here, day or night. So. Non-invasive stuff we do a ton of, and there's people represented here from the non-invasive world as well. That's not the cath lab, so that's stress testing, it's echoes, it's all the stuff, seeing what's going on with the heart either before or after an event. We did echocardiograms this past year. We did over 3,000 at the hospital, and that includes the fancier procedure that Dr. Flores does, what's called a transesophageal echo. Stress testing, about 2,000 stress tests done at the hospital. If you look at the echoes and count back, I forgot to mention this, but over 10 years we've done about 25,000 echoes at this hospital. So enormous amount of resources being used to really evaluate squeezing function of people and how they're doing valvular disease, that sort of thing. Cardiac rehab, Tammy's our cardiac rehab person. We had almost 100 patients go through cardiac rehab this year. You say, well, 100 patients over a year. Well, it's 6 to 12 weeks of 3 times a week. And if you look at the patient visits, it was over 2,000 patient visits over the year coming through cardiac rehab, which really serves a great purpose. So we have a great cardiac rehab program. Unfortunately, we have a delay because we have the need for getting patients in, and there's a delay sometimes, which we're going to try to work on. But it's not because of lack of energy, it's because of lack of space and a lot of people that need it. So those are our numbers. I do want to thank the people that have helped everybody here get through their issues. One second here, back to Jim. I can't say enough for myself about the people that work in the cardiac care portion of the hospital, and that includes the non-invasive and the cath lab. And the people that are sitting up front here, a lot of you have met either in cardiac rehab or may not even remember. The gentleman I talked to didn't remember me doing his heart cath the other day, which is understandable because I drugged the heck out of you, so you don't remember me. In Angel's terms, for better or for worse, you don't remember me. But anyway, you'll know a lot of these people. They rotate, for the most part, all the way through all the different services that we do in cardiac. So it keeps people fresh, it keeps people up to date on everything, gives a break from some of the tension that times can be a little exciting, I'll say exciting, but inducing in the cath lab. It's good. They work hard. We have 6 nurses that rotate on call, along with 4 radiology technicians, and call means that 3 of those people are on call any one night. So the nurses take out vacations, but there's 6 of them. And so they rotate. They're every 3rd night, every 3rd weekend. We have a little bit of help from a couple other people, which is wonderful during times of need. But these people work hard. They're on call a lot. It's a lot to take away from your family to always be tied to a beeper. And when that beeper goes off, you got to run. And so I applaud their help and their performance, and they're some of the best people I've ever worked with. I'll just say nuclear medicine. Nobody here, I don't think, for nuclear medicine. That's our stress testing area. Obviously, very helpful. Emergency services, key. I think they feel a little bit out of the loop when we bring somebody through the hospital without stopping in the emergency room. It's not saying the emergency room doesn't do their job, but as soon as you plop somebody in the ER, it adds about 30 minutes to our time to get them up to the cath lab because everybody's just doing what they know to do. So we try to avoid the emergency room not because we don't trust it. It's just better care for the patient because we have people up in the lab that can do what they need to do quickly. True North, ICU, all the services, in the hospital that do the stuff after we treat patients. EMS I already talked about, phenomenal. We've been working with community ambulance outside of Meadville ambulance service. We've been working with community, Conneaut Lake, and just had nice experiences with people that didn't even know we had these services here, and now they're brought here and get expedited, quick, good care. So I think that's been a huge thing in the last year that we've improved on. The community engagement piece of it used to be called marketing, just to kind of get the word out there, what we're doing. They're essentially sponsoring this event today, helping us out with that. So with that, I think I'm going to ask Willie to come on up, if you would. So Mr. Coggins is I'll tell you his story. He's got some stories. He's a resident of Buffalo. Still is a resident of Buffalo, and he drove down here this morning to share his story. He also comes down here to see us as a patient, and was brought in. I'm not going to spoil the thunder here, but he was brought in by an ambulance, and we were waiting in the cath lab to take care of him. So,
thank you. Well, good afternoon. I'll try not to make this too long, but there were some really good things that happened for me on the way here on that night back in August. Back in August, we have a youth group. And our youth group went to this retreat at a place about maybe 50 minutes away from here. So while we were at the retreat, one of my jobs was to watch over some of the youth, make sure everything goes well. And sometimes among young people, you get those who want to do things they're not supposed to do. So you have somebody like me, who's sort of like a grandpa to some of them, trying to keep them in line. But you do it in creative ways that they don't know that they're being reprimanded or something. So what I did was I went over to one of the cabins after I'd been on like a 2-day cleansing fast at about maybe 12:30 in the morning, and just to make sure everything was going to go okay. And I knew that some of the guys might still be awake, and they were. So I decided to tell them some stories, like Bible stories, a couple of ghost stories, and then for some weird reason, because I've been working out quite a bit, I decided to show them, let's get out some of the energy. So I challenged them to do some sit-ups. How many sit-ups can you do? How many push-ups can you do? And one guy says, well, my grandfather can do 70. I said, that's a good number. We'll work with that. So, and how many more people can do it? So we had about maybe 6 people that were going to try to do some push-ups. And so in the midst of this, I get down and I pop out about, 70 push-ups within about 2 minutes. And I felt good, Like I said, I was in pretty good shape. I thought I was anyway. And then I went back to telling stories. And then some weird stuff began to happen in my body. And I felt a little lightheaded, felt a little queasy. And I just told somebody, call an ambulance. I think there's something going on. Some familiar symptoms came back because I had a heart attack twice before. So eventually the ambulance came. They got me in there. One of the nurses who had been with me, who was at the campsite, Said, he doesn't look good. I'm like, I'm doing better than what you might imagine. I felt still pretty good. Knew that I was going through some stuff, but it wasn't going to be that bad. But eventually, the pressure in my chest became so heavy, it felt like an elephant was, placing his foot on my chest. I'm like, this is worse than anything I've ever experienced anywhere. And I heard the guy in the ambulance say, yeah, his blood pressure is about maybe 60 over or something. I'm like, 60? Can a person live like that? And I'm thinking to myself, okay, well, you're gonna live and not die. Earlier that evening, we had a conference, and one of the conference speakers was saying that one of the things that you need to be able to do is talk about how you're going to make it through life. And then you're in an emergency situation, talk about how you're going to live and not die and declare the works of the Lord. So I'm laying there, I'm going to live and not die and declare the works of the Lord. Blood pressure, 60 over, and I'm like, I'm going to live and not die and declare the works of the Lord. How far do we have to go? Oh, I'd say about maybe 40 more minutes. I'm going to live and not die and declare the works of the Lord. And so I kept my mind focused on that, thinking about the declarations that we were making back at the retreat. I'm going to live and not die and declare the works of the Lord. And I hear them on the phone with the doctor, and they're sending EKGs of my whatever's going on over the phone. I'm like, that's new. Hadn't heard of anything like that before. But finally, we arrived at the hospital. I was amazed because the doctor and his staff were standing there, waiting for the ambulance to arrive. Immediately wheeled me into the cath lab. This is new. And then they got me in there, and the only thing I remember about the cath lab was how cold it was. But they did have warm sheets, they brought that, and that was a big help. So then later on, I wake up, I'm in the recovery area, and I'm like, well, I made it, but everything was going pretty well. And eventually they got me over to the room. I was put in room, I believe it was, if I recall properly, 517, I think it was. And the reason I'm thinking was 517 because I made a mental note. The room that I was in at a hotel in Las Vegas, a week before was, we were on the 25th floor. 2517 was the room number. So I'm thinking, okay, 517 all over again. But then I'm noticing something else, which was a little different. I didn't feel as bad as I had in the 2 previous times I'd had a heart attack. I didn't lose a lot of my memory. My recovery was going faster. After 2 days, I was told I was going to be able to go home, which was new because before it was like 5 days, 6 days, 8 days. But this time it was going to be 2 days. And I'm up and I'm walking around and I'm feeling really, really good. And I found out from Dr. Wilson later on that he had gone in and removed a lot of the plaque that was in my heart, in my vein. And I'm like, they never did that before, which kind of explained why I was having such a hard time after those other 2 incidents. So I'm really thankful for the fact that, number one, I was in the right place to have a heart attack. If it had happened back in Buffalo, I don't know that I'd be standing here today because I never got that kind of care. I would have been waiting in somebody's emergency room for who knows how long before I got to another place, and then I wouldn't have got the care that I needed to get. And some of that plaque would probably still be in there today if I did make it. So I just want to say thank you again, Dr. Wilson, for the work that you did. I want to thank your team, too, for all the great work that you did for me and making me feel very comfortable, making me feel very welcome, and for giving me a chance to be with my wife again. So thank you again.
That's wonderful. So many good stories, good songs. I think that tells you what we've been doing lately with working with EMS, with trying to get people in quickly. If you can get somebody opened up within the first 30 minutes of a heart attack, by the time they hit the hospital versus 90 to 120 minutes, your mortality doubles, essentially, if you go out to the 90 to 120 minute range. So we always say, time is muscle, time is myocardium, it's the heart muscle. And the quicker we can get people open, the faster we can do that. If we had a cath lab on wheels, we'd go do it, but we don't have that yet. But I think it's been wonderful what's happened. So I'm going to ask Dr. Flores to present a song of somebody who, we have a couple people that we're going to be talking about shortly here, just little blurbs, but that I think are good stories. Both of the people a little too close to the situation, a little too close to sharing it publicly, but are happy for us to do that, and I think they're good songs to share. So I'll let Angel do the first one here.
I'll be green. Last name's Flores. Dr. Wilson didn't tell you about the most dangerous line in the heart in Midville, and you have to be very aware of that. Sometimes I feel that we should publicize this and put it in the paper, and it's the day that he's getting a haircut. The day. I want to briefly bring a story of a patient that we saw, which was one of the most memorable stories from last year. And this young lady couldn't make it today. But I think that her traveling through our hospital puts in perspective what we do and what we can do. You see, because it's not just the song, it's the song and the dance is the synchronized movement that takes place from the beginning when the patient has the first encounter through either EMS or the emergency room to the point where they come up to the cath lab and encounter the team, to the time where they go to the intensive care unit and deal with the members of the ICU staff that provide superb care, to the point where the patient is discharged home and followed up in the office by either Dr. Wilson, myself, or Karen Hobbies. This lady was at home and she passed out. Her husband, who is an EMT, heard the noise, an unusual noise coming from her. He called her name and he was not able to get any response. And immediately, based on his training, he started CPR. And as per his account, he performed CPR for 18 minutes until he was able to get her transported to the emergency room, to the hospital, where Dr. Wilson and the team received her in the cath lab. She had a totally occluded right coronary artery that was promptly open. However, because of the time that she was unconscious, because of the time in which her brain was not getting oxygen, her brain did not recover immediately following the heart attack. And this is where the other part of the equation comes. She came to the intensive care unit where our very able team of intensivists, Dr. Lamba, Dr. Fee, Dr. Landsberg, all took phenomenal care of her. And with the help of the neurologist, the respiratory therapist, and all the other members of the team that you don't get to see when the patient is first encountered. By the third day, she began waking up. After 4 or 5 more days of very troublesome and difficult complications that were identified, treated, and resolved, she started making headway, and finally she went home. After she went home, she did a few important things. She quit smoking. And her recovery continued to progress over the next several weeks. And she came back to him in the office approximately 3 weeks after. And there were a couple of remarkable things. The first one was that she was completely ambulatory. She was able to have all her functions. If you didn't know her, you could not identify her as the person who was in the hospital before, as sick as she was for as long as she was. The second part was that her brain recovered completely. And she gave me the best testament to that, which was that when she went back home, she opened up her computer and she remembered every single one of her passwords. But the reason why I brought this patient story is because so many pieces have to be integrated and work harmoniously from beginning to end in order for this type of outcomes to be possible. And this is an everyday story. At times, the song and the dance are shorter, the outcomes are easier, and the patient recovers very quickly. Other times, it takes longer, it takes more effort, it takes more contributions from different individuals. However, the important part is that we have the capability of performing these functions as well as or better than anyone else. We also know up to what point we should perform these functions ourselves and when to ask for help. And sometimes we have to ask for a second partner to come and continue the dance. But this is something to be kept in mind. I have always been reminded that I don't talk very well, so I don't talk for very long, and I'm going to stop right here. Thank you.
Thank you. All right, I'm going to end with one more song here.
This one's kind of close to our hearts here. I'm going to compose myself. This is a tough one for me. Talking about a friend of mine, good friend, a peer, someone who leads our cath lab. She's the core. She's a nurse. And one thing I know forever is there's no such thing as a retired nurse, so she'll always be a nurse. She's a golfer, although I've never seen her golf. You guys can probably attest to her golfing. She's always been a patient advocate. She's worked in the ICU before she worked in the cath lab. She's a safety advocate for her patients. She's a teacher, she's a learner, she's a process leader. Any new thing that comes in, she's not afraid to say up or down, why are we doing this? What are we doing? She's not afraid to ask questions. She's fun, she's cool. She doesn't feel special. Maybe she does feel special, but she wouldn't let on that she's special. She is special, but she's one of us. She's literally one of us in the cath lab, in the community, and had a song to tell. So it was about 5:30 in the morning. We got called for an emergency, and I just want to stress this is what you don't want to hear at 5:30 in the morning, okay? For these guys sitting here, what it means is I need to get up and go to the hospital because somebody needs to go to the cath lab emergently. I get that. It could be a phone call I need to answer, but I'm in the same mindset. I get up, the adrenaline's going, you're thinking, what time is it? Where did I leave my scrubs? Where's my clothes? Because we have to get in as quickly as possible. So we got called in for an emergency. The weather was horrible. The drive for me is short, but the drive for my other people was not. I just happen to live the closest to the hospital. And then got to the hospital. For some reason, I came up to the cath lab, and normally I go to the emergency room waiting for the emergency to come up, but the time frame was such that it was close to having the team getting there. So I just waited there and thought the cath lab, the emergency people would bring the patient up from the emergency room. So along comes my team. Denise comes in. Denise running into the cath lab and collapses right in front of us. Cardiac arrest, full-blown cardiac arrest, right beneath me. Talk about helpless, feeling helpless. I have a cath lab 6 feet away. Every time somebody tries to die on me, they're in the cath lab and I can just fix things. She's laying on the floor at 5:30 in the morning, no IV. I have one other person with me who was awesome, one of the nurses in the cath lab. She ran, got the monitor, got the defibrillator. What Denise doesn't know is that I gave her the ultimate kiss. No tongue, but a good blow of air down her lungs. And we started CPR. And then we shocked her back into rhythm again. And I had wonderful people around that came. Somebody got an IV in quickly. Brittany, who is the nurse in the lab, was unbelievably quick with getting her hooked up, showing us what rhythm we thought we had, got her back. We immediately, interestingly, had to maneuver getting her out of the holding area into the cath lab because we figured out after that point you can't get a gurney in there. So we kind of hoisted her up over the counters and got her on a gurney and in the lab. A lot of emotion. By the way, the person in the emergency room that was having the heart attack, we transferred them up to Erie, and it turns out she wasn't having a heart attack. As it turns out, she saved you. Anyway. So anyway, it's the only reason we would have been in to save her. She would have died at home on the floor in her kitchen. So the moral to the story is, pick your friends wisely. If you're gonna have a heart attack, a cath lab's a good place to do it in. If not, EMS is a good friend to have out in the community. And if not that, somebody who can do bystander CPR, who can save a life. So it's a hard moment, but it's a wonderful moment. And Denise is here with us, working every day, working like a dog, challenging me every day. And we just keep getting better. So I'm gonna leave it at that. We're gonna stop now, and we'll have a little raffle. You guys can get any eat or drinks you want. Karen, I'm gonna have you pull the numbers since you seem to be the lucky one. So we're just gonna have a little raffle. There's some stuff on the back table back there that mainly is heart-related things. I appreciate everybody coming today. I know it's time in your Saturday afternoon. I especially appreciate Mr. Coggins for driving down from Buffalo, and his wife, really an exceptional person. And fortunately, we'll get to see him back again because I think he's going to keep coming to see us here. Hopefully, you guys in the cath lab will never see him again. That would be perfect. But we will be seeing him in the office regularly and work together to keep us all in the same path. So thank you very much.
No, April 30th. Oh, they can't. canceled. I think we had an appointment and that changed. Well, you know what, we had one day that we had
Hi, I was